I would just like to say that I know that when I talk to my friends or family about this, they don't understand. And I know that people who have chronic pain, chronic issues, I know you understand what it's like to lose hope. And I'm very grateful. I was hesitant to do this because, frankly, the more people that find out about this, more people are going to come, and then it'll be harder for me to get in. But, you know, if you're feeling like you're giving up hope and you have the ability to get here, do it. And you won't be sorry.
How would you rate that pain that was on top of your head?
You know, that was a good 9 or 10.
Mm-hmm.
I mean, internally,
You felt the burn?
I literally felt like something's cooking my brain from the inside.
How often was that before?
So again, that also 3-4 times a week. That actually probably wasn't as frequent as the body pain.
How long would it last for when it did occur? 3-4 days a week?
Oh, that could last several hours.
When
It was scary, actually, quite honestly.
How morning brain pain?
I think twice.
Twice in the whole year.
Yep.
And for how long have you had them when they've occurred? Had it when it's occurred for those 2 times?
Maybe 30 minutes or so.
And how severe is it when it does occur? Is it still that 9-10 or is it
No.
less?
5, 6.
5-6, okay. So twice, short period of time, we're overcoming that.
Yep.
Which is significant. Awesome.
6 or 7.
How frequent was that? Was that an everyday experience, that burn?
Got to a point where there were several times a week, if 3-5 times a week.
And for how long? Would it just be like a moment of a burn, or was it lasting for several minutes or several hours?
It could last several hours.
Mm-hmm. Now, when was the last time you had that body burning pain?
I don't even remember. It probably even close to a year.
Almost a year. Just about a year. Better.
1000% better.
1000%.
Yeah.
Like a crushing in the chest? Was it something squeezing your chest? Was it a wheezing? How would you describe your breathing disorder at the time?
Fish out of water. I think that's the way it's described. And
CT scan, abnormal finding. The right lung, non-calcified nodule. It had increased in size from 2.5 millimeters by 6 millimeters to 4 millimeters by 7.5 millimeters. So it turns out that the 4.0 millimeter by 7.5 millimeter, or 4 by 7.5 millimeter nodular density in that right upper lobe had significantly decreased down to 1.5 by 4 millimeters.
A lot more energy. I, in fact, now work outdoors a lot.
Do you suffer from chronic illness? Are you suffering from chronic pain, chronic fatigue? Are you suffering from brain fog? Also, have you been told in certain laboratory tests that have been done on you that you actually have some abnormal tissue findings, like nodules that appear in tissues in the thyroid or in the lungs or in another part of the body? My name is Dr. Lonnie Herman, and I'm going to share with you about a great patient here. This is Tom. He comes to us from the western part of the U.S., where right now we're in South Florida doing this great work to help people heal. And Tom has shared some amazing results here from his experience, from these results from working with me and me with him to help him get better and help him get relief of these symptoms, in addition to help remove, which was almost a surprise for you. And it's a great thing, but it wasn't the main purpose why you came here. You didn't realize I could do that work with you and for you. But he actually had some significant growth of nodules in his lungs, or actually in the right lung. So we're going to talk about that. We're going to talk about some pain relief and the reduction, significant reduction in the nodule. Okay, so Tom, you before you came to me, which was in about 2017 or mid-17, I think you first came to me in June of 17. You were suffering for a while with various symptoms, including you had burning body pain, right?
Yes.
And we'll talk about the severity of these. Let me just make a list of these first. Burning body pain. You had burning brain pain. Right?
Yes.
You had fatigue, horrible fatigue. Is it fair to call that a chronic fatigue syndrome?
Actually, that's what my doctor called it. So
That's
yeah,
okay.
I think that'd be fair.
You had a brain fog.
Mm-hmm.
You had major sinus troubles.
Yes,
You had major respiratory troubles as well.
I did.
You had breathing problems. You were on an inhaler,
Yes,
and the inhaler was, which one was that again?
albuterol, ProAir.
And that you were using that albuterol every day,
Yeah, yes.
and more than one time a day, sometimes more than once a day.
Oh yeah.
Yeah, against their recommendation, but you still had to do it.
Well, albuterol, you can use it. I think it's every 4 hours,
Mhm.
and sometimes it would be 2 hours. I mean,
Okay, so you're doing it just more frequent. You can
Yeah.
do it more than once. Excuse me, I
Right.
didn't know that. Sorry. But you were doing it more frequent than they recommended
At times, yeah.
because
But I couldn't breathe.
you couldn't breathe, and literally couldn't breathe to where you felt like a. Was it like a crushing in the chest? Was it something squeezing your chest? Was it a wheezing? How would you describe your breathing disorder at the time?
Fish out of water. I think that's the way it's described, and that's just, I don't know. It's not pain. Just
Mhm.
can't breathe.
Couldn't fill up your lungs.
Yeah.
You couldn't. And you actually had to put an extra effort to fill up your lungs. I mean, you had to really struggle to try to breathe in.
You know, if that were I would have struggled through that.
Mhm.
No, the problem was that even
Even with that
with
struggle,
that extra effort, I
still
couldn't get air.
couldn't get air.
Yeah, so it's
That's scary.
very scary.
Yeah.
And I've never had issues like that growing up.
Mhm.
I'm
No asthma?
54 years
Never
old.
a smoker?
No, I mean
No?
a little when I was younger,
No.
but no asthma.
No asthma, no emphysema,
Nope.
no lung cancer, nothing in that in your history.
Nope.
And you came here not because of what they found, which we'll get into the size of these nodules. We're going to talk about that
Right.
in a little bit, but you came here because of the pain. the
You know,
fatigue.
I mostly came here because for several years I was going from doctor to doctor trying to figure out why do I feel so horrible all the time and getting, worse.
Mhm.
I used to be very healthy in my earlier life, and in my late 40s, mid 40s to late 40s, I wanted answers. I was looking all over, and that's how I found you, looking on YouTube for all kinds of different things, and came across you. But yeah, I mean, I had that, so that's why I came. I was just tired of feeling crappy all the time.
And what kind of doctors had you gone to for all that time?
Actually, I have been to, of course, allopathic, regular MD guys, specialists for the lungs, for rheumatoid arthritis. I got diagnosed with rheumatoid arthritis, a rheumatologist, neurologist, but I've also done all kinds of so-called alternative healings through the needle, acupuncture and chiropractic and diet and all kinds of. There was one guy, I don't even know, he was anyway, the bottom line is lots of different things, and yeah. So
Yeah,
I was
you
not
can-
shy about trying new things.
Mhm.
Frankly, I was pretty tired and didn't know that this would be of help. So
But you tried. You wanted to get better.
yeah.
And your chronic pain and the chronic head pain and the respiratory problem and the hand pain you had and the arthritic pain, all of this was taking so much energy from you that you even weren't able to work for a while.
Yeah,
Yeah.
yeah. I mean, it was several years. My work capacity. In fact, I was fired from several jobs because of my brain not functioning
Mhm.
consistently.
Mhm.
I have two small boys. They're 11 and 13 now. But trying to manage them, single dad, and just trying to. There were times where I couldn't get out of bed, and they got to make their own food, and it's just not good.
Okay.
Yeah.
Let's fast forward to now. The body pain that you had, 0 to 10 well, fast forward to now, so let's compare what it was. The body pain that you had, it was full body pain? The burning
Yeah,
body
yeah.
pain that you had, burning body pain. That was all over the whole body?
It would move around.
Around.
So,
And
yes.
0 to 10, if 10 is the worst, burn. 10 is burning, terribly burning. We're on fire. How would you rate? And 0 means no burn.
So
How would you
probably, at the worst, probably 6 or 7.
How how frequent was that? Was that an everyday experience, that burn?
Got to a point where there were several times a week, if, 3, 5 times a week.
And for how long? Would it just be like a moment of a burn, or was it lasting for several minutes or several hours?
It could last several hours.
Okay. And now that burning pain that was about a 6 or 7, lasting several hours, several days a week. Now, when was the last time you had that body burning pain?
I don't even remember. It probably even close to a year.
Almost a year. Just about a year.
So,
Close to a year.
I mean, I came here a year and a half ago, so I think it's been probably, I know it's been not this year, it probably
So
into
all
last
of
year.
2018, you've had no burning body pain?
No,
None.
no,
Awesome. That's significant,
no,
right?
it is for
And,
me. It's
yeah,
great.
it's significant for everybody, and everybody deserves to know that, so it's real, it can happen. The burning head pain, the top of your head, you feel a burn. So 0 to 10, if 10 was the worst, before we met, 10 is the worst burning. How would you rate that pain that was on top of your head?
That was a good 9 or 10.
Mhm.
And it's the weirdest thing. It felt literally like my head was in a microwave oven.
Mm.
And I don't know how to describe that. It was burning. I wasn't sweating, I mean, internally,
You felt the burn?
I literally felt like something's cooking my brain from the inside, like a
Wow.
microwave.
And so now the burning head or burning brain pain that you just described, pretty severe. Pretty severe. How often was that before?
So again, that also 3, 4 times a week. That actually probably wasn't as frequent as the body
Body.
pain.
How long would it last for when it did occur? 3, 4 days a week?
Oh, that could last several hours.
Hours. When
It was scary, actually, quite honestly.
Since, let's go with this year, because we're in October 25th, 2018. So in the year of 2018, going from January to now, how many times have you had the burning brain pain?
I think twice.
Twice in the whole year.
Yep.
And for how long have you had them when they've occurred? Had it when it's occurred for those 2 times?
Maybe 30 minutes or
30
so.
minutes. And how severe is it when it does occur? Is it still that 9, 10, or is
No.
it less?
5, 6.
5, 6, okay. So twice, short period of time, we're overcoming that,
Yep.
which is significant. Awesome.
Yeah.
Your, the fatigue level, the exhausted fatigue level, chronic fatigue syndrome that was diagnosed by that doctor, that was an MD who described it
Yeah.
to you? So that chronic fatigue syndrome diagnosis, what is your energy level like now? I mean, are you able to get up and do things? Are you stuck at home? Are you stuck in bed? Or are you working, doing, and
Well, fortunately, I have a lot more energy. In fact, now work outdoors a lot.
Mhm.
I do a lot like construction-related stuff. I can work a 10, 12-hour day outside in Arizona in the sun and not collapse. So I'm, not that I
maybe a bit tired when you get home from working all day, but
absolutely.
but you're not stuck like you were, because you told me at one point you were actually, from the chronic fatigue, you were stuck in bed. You couldn't even leave bed for a month.
It was about 3 weeks or so. Yeah. I mean, I just couldn't. Yeah, and that's when I couldn't breathe. I mean, I was just really having a lot of problems.
There you go. So now the energy is way up, and you're working.
Yep.
You've got that outdoor work, and you're actually started your own business with online.
Yeah, I'm doing
That's
some
lovely
online
website.
stuff
Excellent.
because I'm not thrilled with working outside in 110 degree.
But still great that you can actually do both of these.
Yes.
And you're working and you're doing it, and you're not stuck at home with the fatigue and the
Well,
pain.
in the online stuff, I mean, I couldn't do that because my brain wasn't firing properly.
So now there's a lot more clarity in brain.
And now I can be more productive, and things are, getting much better.
How much difference, if we could give like a percentage of reduction of the brain fog, to say the brain is clearer by so much percent, is there a way to do that? Do you think you're
Yeah,
50%
well,
better, 20% better?
1,000% better.
1,000%.
Yeah.
We still have a little bit more to go.
Yes.
Yeah, but you can it's just so much clearer up there.
And I want to be clear with people that I am not rolling in money. I don't have tons of money. I come out here, it costs me a lot to do that, but I do it because I know I wouldn't spend the money if I didn't know that this is going to work.
Mm-hmm.
And like I said, I mean, I feel 1,000% better than I did even a year ago. So I'll be back. I'll
Awesome.
keep coming.
Significant. You're right.
Yes.
Now, the other big point that we're going to make
Yes.
here. In 2016, when you had the respiratory problem, when you were having a hard time breathing, you went, you had, let's just fast forward to one point that came up, because you had an X-ray, then a CT, and then you had another CT in 2016. And on the report, which I will put an image of the report, I'm going to redact your whole name and the imaging center where it's done. But in 2016, the nodule in the right lung, it was written here in the report that a non-calcified nodule, well defined in the upper lobe, 2.5 millimeters by 6 millimeters. That was in 2016. In 2017, abnormal finding, another CT scan, abnormal finding, the right lung, non-calcified nodule. It had increased in size from 2.5 millimeters by 6 millimeters to 4 millimeters by 7.5 millimeters. We started working together. I did start finding, which I can make another video out sometime, of the findings of what I discovered, different kinds of bacteria, mold, fungus in the lung tissue with a very unique system that I practice here. I can find in the lungs, almost as if it's like taking a biopsy of the tissue and finding from a laboratory exactly what's in there. I found in the lungs, I found in the bronchioles and the bronchi within his respiratory system. I found various bacteria and candida and mold and so on, and provided remedies for those. And he had another scan, you had another scan done in 2018. And it shows here in this scan, this is the way the report was written, and then I asked you to go back and get a better description, if you remember, because they didn't give us numbers,
Yes.
right?
Okay.
So what it said first was, the previously described 4 millimeter by 7.5 millimeter nodular density in the right upper lobe has significantly decreased. Then you went back, because I said that wasn't good enough to know. You went back and you had another written report. They did an addendum to the report. And so it turns out that the 4.0 millimeter by 7.5 millimeter, or 4 by 7.5 millimeter nodular density in that right upper lobe had significantly decreased down to 1.5 by 4 millimeters. It went down significantly lower than what it was when they first found it in 2016. Now, I want to make one point here. This is not just by whether you call it coincidence and just think that that's some miracle or coincidence or something. We're using specific scientific practice and protocols that are developed for the individual. So when the doctor ran the first scan on you in 2016 and found that 2.5 millimeter by 6 millimeter, they didn't give you any medication, but they did tell you to come back in a year. It came back in a year and it grew.
Mm-hmm.
And it grew from 2.5 by 6 to 4 by 7.5. Almost double, well, that's double, but it significantly increased, okay? So it was going in the direction of getting bigger. He was going in the direction of getting sicker. He was having a problem breathing, using inhaler on a daily or almost daily basis, multiple times a day in some days, and the brain fog, and the body pain, the burning, and the arthritic swelling, inflammatory feeling in the hands, and the burning head pain, and the chronic fatigue, and the whole thing that we just went over. His numbers kept going up. The size of the nodule kept going up in the right lung until we started working together. So it's not just, I don't see it as just a coincidence. And the doctors can say, well, that's just happened because that's just, sometimes that happens. Well, why was it getting bigger and why was he feeling worse until we started working together to clear out the hidden infections and toxins from various tissues, including but not limited to the lungs and the respiratory area. There were other tissues that I'll get to in another video. Now we see the nodular density go down in size, significantly lower than what was first discovered, and 1,000%, you're feeling 1,000% better, and the inhaler is used at all, no, and he's not having a respiratory problem, maybe around pollen, which we'll get that fixed in like springtime, but there's no respiratory problem now. The sinuses have dramatic improvement with the sinuses, even though we still have a little more to deal with those.
Mm-hmm.
If we haven't talked about it, he had major sinus congestion. He was having a hard time breathing because the sinuses were chronically stuffed all the time. Yes?
Yeah.
Fair to say?
Yeah.
And so the burning brain pain just about totally gone in this whole year. The burning body pain is gone for the whole year. The chronic fatigue is gone pretty much. Significant improvement in energy.
Yeah.
Brain fog, significant improvement in clarity and thinking, and being able to function and do things, and actually have 2 businesses now that he's doing. And we have a significant improvement in the reduction in the size of the nodular density in his right upper lobe. So is there anything else that you want to, you don't have to, but if there's anything else you want to tell people?
I would just like to say that I know that when I talk to my friends or family about this, they don't understand. And I know that people who have chronic pain, chronic issues, I know you understand what it's like to lose hope. And I'm very grateful. I was hesitant to do this because, frankly, the more people that find out about this, more people are going to come, and then it'll be harder for me to get in. But the truth is, that there are a lot of people that I know will benefit. I know anybody would benefit. Even people who think they're healthy would benefit, obviously, from getting their pipes cleaned out, so to speak. So if if you're feeling like you're giving up hope, and you have the ability to get here, do it, and you won't be sorry.
Yeah.
So
Thank you. Appreciate that, Chair. That's great. You can heal when we know what to do and follow specific, unique protocols, unique exam process, and get down to the roots, the hidden infections and toxins in the tissues, and help you safely eliminate them from the body. And you too can recover. And we still have a little more to do for this gentleman here, but it's only going to keep going in the same direction, in a positive direction, getting better and better and better, not getting worse and worse and worse. You've got to be able to find these hidden disease-causing agents in the body and provide safe and effective protocols to remove them so that you can stop suffering. Simply put.
Yep.
Thank you for sharing this with everyone.
thank you.
Greatly appreciated. You're welcome.
My pleasure.
And you can call our clinic when you're ready, or pass this video on to a friend or family member you know is suffering, who deserves to hear this real heartfelt message that he just shared with you, and the results I'm sharing on the screen here. So really share this video with a loved one or a friend, who your coworker or somebody who you know, or just share it out there for anybody you know on social media who deserves to know that you can get better. You don't have to suffer anymore. Okay, you can call my clinic at 954-370-3100. That's 954-370-3100. And you can email my lovely clinic assistant, who's very happy to help you. She will help you get an appointment here. The email address I'll put up on the screen here as well. I will let you know in advance that unfortunately insurance policies, all of them that we've checked into, do not cover this unique type of care. So it will be an investment on your part, but my assistant can help you get an appointment. People do fly from across the country and from other countries for this unique work I'm doing, as well as you can, I'm sorry, another step I want to mention, you can actually scroll down on the videos on my YouTube channel and hear about all the different conditions that I'm helping people get better from. And sometimes it takes a bit longer from one person to another. The speed of recovery varies from one patient to another, but you can really heal. It can happen. You don't have to live with this pain. You don't have to live with the suffering anymore. I look forward to helping you. Again, thank you for sharing this. We really appreciate it. Hope to see you soon.